Are you suffering from the symptoms of neuropathy? Have you been given drugs to kill the pain or for the other symptoms? We have an all-natural treatment program, which consists of structural realignment, meal planning, and technology to restore the health to the damaged nerves and the damaged blood vessels that are causing this condition. Call now for an appointment. It will include an explanation of your problem, if we can help you, how long it will take, and how much it will cost. Take advantage of our very special offer, which is $25 to find out.
Welcome back. Well, today we have on Dr. David Manigault, and he is a chiropractor, but today we're going to be talking about neuropathy. Nice to have you here, sir.
It's great to be here. Nice to see you again.
Great. And my question, as I alluded to a little bit earlier, is how does neuropathy relate to being a chiropractor?
Well, you realize that a chiropractor learns about the nervous system.
Right.
And so when there's stresses on your body that affect the nervous system, that's a chiropractor's job, is to figure that out and fix it.
Okay.
So peripheral neuropathy involves the nerves, and I happen to be a specialist in that I don't do any back cracking. I actually use thermography to measure and locate nerve interference.
Okay.
So that sets me apart a little bit from the average guy.
Yeah, I was kind of wondering how they related to each other. So we're talking about neuropathy today, and as your slide shows here, it literally means disease of the nerves, basically, right?
Correct. Yeah, the nerves get diseased. There's many causes of that, but the underlying problem is actually that the blood flow that feeds the nerves begins to deteriorate.
Okay.
It's very similar in diabetics, for example. They have circulatory problems.
Right.
They go blind. They have to amputate their toes. It gets to be a very serious condition because the circulation that's supposed to oxygenate and feed the nerves breaks down, and the nerves begin to die.
Right.
And that's where the pain comes from.
Okay. So what you're feeling, you have these symbolisms here of different types of pain. And is some of the sensations almost like, that old saying when your foot falls asleep or something, you get that tingling feeling that sometimes can be quite painful. It doesn't last very long. But is that what somebody might start to feel on a more regular basis? Usually
they start to feel tingling, or as the pictures show, they can get burning at the bottom of their feet. It can feel like they're walking on tacks. They can feel like something's crawling on their feet. Sometimes in the middle of the night they get a restless leg syndrome, and they just aren't comfortable walking anymore.
Okay.
It becomes very debilitating.
And this is where it usually manifests first, in your lower extremities?
This is where it most commonly does.
Okay. And what is actually happening to the nerve? You mentioned about blood flow.
Well, here's a really good picture of it. If you look at the red, you can see the tiny capillaries are winding around a healthy nerve, and they bring oxygen to the nerve. They bring all the vitamins and minerals that the nerve needs to be well. So that's what it's supposed to be like. The second picture shows the diseased blood vessels are starting to break down. You can see that in the picture. So as the blood vessels break down, there's less oxygen, less nutrients to the nerves. So the nerves begin to go through the process of dying, and that's when people begin to get the symptoms.
Okay.
And then the bottom slide is really the worst case scenario. You can see there's no blood flow.
Yeah.
And if you see this gap there, the nerves actually separate. So in order for the energy to get from one part of the nerve to the next part of the nerve, it has to jump that gap. Kind of like the old day when you would gap a spark plug.
Right, yeah.
So if that gap is too big, the nerve transmission can't get to the rest of the nerve.
Okay.
So this is when people literally, they just can't walk.
Okay.
Or they can't use the muscle.
Yeah.
And it's a very painful condition.
And here you show some different types of where interference can happen. And lead to the different symptoms, right? And why we feel this pain or tingling or whatever it may be.
Exactly. When you look at the chart, it breaks down where the nerves go. In particular, the cervical nerves go to the shoulders, arms, and hands. The ones in the middle go to the rib cage, back and front. But the lower back ones are the most important ones because most people get their neuropathy in their feet.
Okay.
So the most important thing that I feel for anybody treating neuropathy is they have to check the lower back to see if the nerves are being pinched physically.
Okay.
So you have two things happening. The physical aspect of a spine being misaligned or a disc degenerating or something that's actually pinching the nerve. And then you have the lack of nutrition that's not feeding the nerve, so the nerve is dying from malnutrition.
Okay.
And those two things both have to be fixed.
So I know we're going to get to the treatment, but first, this is part of the cause. Is it generally related to the lower spine, or could there be other causes as well? I mean, you mentioned diabetes, which would certainly be a cause, but are there hereditary causes, or maybe somebody was an athlete and had some sort of an injury or whatever?
There are many, many, many causes.
Okay.
There's too many to mention.
Okay.
And they usually happen together.
Yeah.
And the most common problem is a person becomes toxic from their lifestyle, from Agent Orange, from eating bad food.
Yeah.
You name it, we're in a toxic type environment. So one of the first things we have to do is detoxify a person. Because those toxic conditions also cause problems functionally with the nervous system.
Okay. So we're looking at a treatment here, and is it Vivaz? Is this what it's
Vivaz,
called?
yes.
Okay, so explain what this is and how it works and how you use it.
This is actually like a power unit, and there's 8 wires that come out of the back of it,
Okay.
and there are 8 paddles, if you will. They're like 8 by 5 paddles, and they have a series of
okay.
LED lights on them. So it's been proven over and over that LED lights open cells. They open fat cells, they open blood cells, they open up cells. So the object of the Vivaz treatment is to actually open up the blood flow, to begin to create a more normal blood flow to the nerve itself so the nerve can heal and recover.
Okay.
And that's what this is about. So when a patient comes in, we put the paddles on them for 10, 15 minutes to open up the blood flow. And then there's another unit, which we don't have a picture of, called whole body vibration, that actually shakes the lymphatic system and shakes the blood flow and really wakes up the circulation in the body.
Okay. So how exactly are the LED lights doing this? And someone might ask, well, gee, everybody's like, my house is now almost all LED lights and saving energy.
Good.
But is that helping me? Is that energy? So exactly, are they certain kinds of LED lights? Because people, are they the same kind that are in a light bulb? What are they doing exactly? Are they vibrating on and off really quickly?
It's been shown through research, and one of the big researchers in this area is NASA. They did research to show that LED lights open up cells. There's specific frequencies of light that come out of the Vivaz.
Oh, okay. Oh, look, we have a picture right here. Okay.
Yeah, so there's specific frequencies that come out of the LED lights. It's not like you can sit in your room with your LED lights.
Right. Well, that's
and get
that's when
treated.
people hear that, they're going to think, they want to know what the differences are. And is this sort of causing like an electrical stimulation? And is that kind of what's happening, or?
It's not electrical.
Or
it's
regenerative?
more functional. It actually opens up the cells so the flow can return.
Okay.
Basically, your body's not healthy if there isn't a flow.
Of course, yeah.
So if you restore flow, then your body can heal itself and you get well.
Okay. As far as these treatments go, how long does somebody need them, and how long are they effective? Like, you get this treatment, you'll be good for a week, or?
Well, of course, it depends on how bad the problem is.
Okay.
So when a person comes in, there's 2 things we do. One is we actually check their spine to see if there's nerve irritation, and we use thermography.
Okay.
I don't do any traditional back cracking, which is why I see a lot of seniors who are afraid of that process.
Right, right.
And so we use thermography to measure the nerve irritation, and then we make adjustments with 6 ounces of pressure. The second thing we have to do is take an x-ray. So we can see if it's their feet in the lower back area. We have to see if there's a degenerative disc, if there's lots of arthritis, or if the bones are just fused and then we can't help the person.
Okay.
So
at that point, it's another treatment then.
At that point, you know, it's basically relief care, and
Yeah,
they're
okay.
probably not a correctable case.
Okay, all right. Now, as far as people coming to see you, do they make an appointment directly with you? Do they go to a primary care first? How does that work?
You know, they make an appointment directly with me.
Okay.
If they've already been to a doctor and they have a diagnosis of neuropathy and they have an MRI, that's useful for me.
Okay, got it.
That helps me figure out if I can help them.
Okay.
But basically, they just call my office, make an appointment, and I actually set aside an hour and 15 minutes of my personal time, and I go through the whole process with the new patient. So they understand what I'm looking for, and then I take them in the exam room and figure out if that's what they have.
Okay, and I understand, I know on the slide here we have a couple things, and I think if it gets clicked through, your other information might come up. But the point is, what we want to say here is your consultation, examination, x-rays, it's normally $290, but you have a special, right?
Yeah, my special for anybody who's watching this show, it's only $25 for
Okay.
everything on the first visit.
Great.
I can't do it for free, but I can do it for $25.
Yeah, especially if you get the x-rays are needed.
That's the cost
there we
of
go.
the
They pop
x-rays.
through. Thank you.
There you go. So
that's fantastic.
yeah, it really, I like to have the cost low in the beginning because I don't know if I can help the person.
Right.
So it lets them find out, and then if they can be helped on the second visit, I go over the whole program and the findings and explain to them how we can fix your problem.
All right, and it's something that you really want to get taken care of, because if you don't, as you said, especially if it's in relation to diabetes, even if it isn't, it can really lead to something far more extreme.
Well, I don't know if I have time, but just a quick story is I had a patient.
Sure, yeah, you got a couple minutes.
I had a patient that came in and she was wearing a boot on her foot. And the boot was to protect the foot because she couldn't touch anything with the foot because it hurt too much.
Wow.
And nothing could touch her foot because it hurt too much.
Yeah.
And we started treating her, found problems in her lower back, and gave her the VVAS treatment for the neuropathy. Within 8 weeks, she was driving herself to the mall and walking around like there was never a problem.
Fantastic.
It was fantastic. And
Yeah.
so we love to talk about her because her results were phenomenal. And she sat down with me once and said, you know, Dr. Manigo, if you couldn't help me, I was going to tell the doctor to cut off my foot.
Wow.
This is a true story.
Yeah.
It just happened about 3 months ago.
Wow.
So
interesting.
why would a person ever want to get that bad?
Yeah, exactly. Well, I want to give you Dr. Manigo's phone number. It's 949-364-5656. Where are you located?
I'm in Mission Viejo, right by the Mission Hospital on Crown Valley Parkway.
Sure. All right. Know exactly where that is. Thank you very much. Nice to see you again.
It's been my pleasure,
Good
Ken.
information,
Thank
and
you.
we will be right back.